The impact of rising carbon dioxide concentrations on viral infections, an extended review. Chapter 1. Introduction. The complex interplay between escalating global carbon dioxide (CO2) levels and public health is becoming a focal point of scientific and policy discussions worldwide. This comprehensive review aims to delve deeply into how increased atmospheric CO2 may be influencing the spread and severity of viral infections. This subject has garnered increased attention due to recent global health crises that have highlighted the urgent need to understand environmental impacts on public health. As the principal contributor to greenhouse gases, CO2 emissions from fossil fuels, along with industrial activities, agricultural practices, and deforestation, have propelled atmospheric CO2 levels to the highest seen in millions of years. This unprecedented rise calls for an immediate review of our carbon management strategies and a reevaluation of their long-term implications on health and environment. Health challenges posed by elevated CO2 levels. Elevated CO2 levels primarily impact health through their significant contribution to climate change, affecting both air quality and the broader ecological systems that support human life. Indoor CO2 accumulation, a prevalent issue in inadequately ventilated modern buildings, notably impairs cognitive functions and overall well-being. For instance, landmark studies such as those by Allen et al. 2016 have shown that indoor CO2 levels exceeding 1000 ppm can drastically reduce cognitive abilities, affecting decision-making performance, strategic thinking, and information utilization. These impairments are particularly concerning as they directly influence productivity and learning outcomes in educational and occupational settings. Moreover, the physiological impacts of high CO2 levels manifest in increased respiratory volume and rate, potentially leading to hypercapnia, a state where CO2 builds up in the bloodstream, creating a cascade of health issues including respiratory acidosis, headaches, bone resorption, and kidney complications. The cardiovascular system may also become stressed as it attempts to compensate for these acid-base imbalances. Furthermore, CO2 concentrations in sleeping environments can disrupt sleep quality, leading to increased drowsiness and impaired daily functioning, as documented by Strm Techson et al. 2016. Indirect impacts through environmental changes. The indirect health impacts of rising CO2 levels are just as profound. Global warming, driven by increased CO2, intensifies heat waves and urban heat islands, significantly affecting vulnerable populations through heat-related illnesses and potentially fatal conditions such as heat stroke. The alteration of ecological patterns also affects the distribution and prevalence of various pathogens and vectors. Warmer temperatures extend the breeding seasons and expand the geographic range of disease-carrying vectors like mosquitoes, elevating the risks of diseases such as malaria and dengue fever. Simultaneously, fluctuations in humidity and temperature influence the viability and transmission rates of airborne viruses, thereby altering infection rates of diseases like influenza. Additionally, higher CO2 levels often coincide with elevated concentrations of other pollutants like ground-level ozone and particulate matter, exacerbating respiratory conditions such as asthma and chronic obstructive pulmonary disease (COPD). Wildfires, becoming more frequent due to climate change, further deteriorate air quality and pose additional respiratory hazards. Navigating public health strategies. Addressing these multifaceted health challenges necessitates comprehensive public health strategies that integrate improved indoor air quality, heightened public awareness about the health impacts of air quality, and incorporation of climate change impacts into health planning and policy making. The efforts to reduce CO2 emissions are crucial not only for mitigating climate change but also for shielding public health against the diverse and severe impacts of elevated CO2 levels. These strategies must be multifaceted, combining environmental, health, and policy perspectives to manage and preempt these health risks effectively. This introduction sets the stage for a detailed exploration of the mechanisms by which CO2 may influence viral infections and the broader implications for global health policy and practice. Through this review, we aim to present a holistic view of the potential public health challenges posed by increased CO2 concentrations and propose actionable strategies to mitigate these impacts effectively. Chapter 2: Carbon Dioxide and Environmental Health. Sources and Trends of CO2. Fossil fuels are the primary source of anthropogenic CO2 emissions, contributing over 65% of global greenhouse gas emissions. Industrial activities, agricultural practices, and deforestation also play significant roles. According to data from the World Meteorological Organization (WMO), current CO2 levels are the highest they have been in millions of years, emphasizing the critical need for effective carbon management strategies. Health impacts of high CO2 levels. Elevated CO2 levels affect health primarily through their contribution to climate change, which in turn affects air quality and public health. Indoor CO2 accumulation, a common issue in modern buildings, can significantly impair cognitive function and overall well-being, with concentrations above 1000 ppm linked to decreased decision-making performance and increased health complaints. Allen et al., 2016. Direct health impacts of high CO2 levels. 1. Impaired cognitive function and decreased productivity. Studies have shown that higher indoor CO2 levels, commonly found in inadequately ventilated buildings, can significantly impair cognitive function. A landmark study by Allen et al. 2016 reported declines in decision-making performance, information utilization, and strategic thinking as indoor CO2 levels increased to 1000 ppm and above, which are common in crowded classrooms or office spaces. This reduction in cognitive abilities can affect productivity and learning outcomes in occupational and educational settings. 2. Respiratory and cardiovascular stress. While CO2 is a natural byproduct of respiration and generally not harmful in small amounts, elevated levels can lead to an increase in respiratory volume and rate, known as hypercapnia, when CO2 builds up in the bloodstream. Chronic exposure to high CO2 levels can cause respiratory acidosis, a condition where the blood becomes too acidic, which can further lead to complications such as headache, bone resorption, and kidney issues. The cardiovascular system may also be stressed as the body attempts to compensate for acid-base imbalances. 3. Sleep disruption. Increased levels of CO2 in sleeping environments, such as bedrooms with poor ventilation, can negatively impact sleep quality. Research has suggested that elevated CO2 can increase the number of awakenings and decrease the overall sleep efficiency, leading to drowsiness and impaired daily function. Strm Techson et al., 2016. Indirect health impacts through environmental changes. 1. Aggravation of heat-related illnesses. Rising CO2 levels are a significant contributor to global warming, which exacerbates heatwaves and urban heat islands. Heat stress from these phenomena can lead to direct mortality from heat stroke and other heat-related illnesses, particularly in vulnerable populations including the elderly, children, and those with pre-existing health conditions. 2. Altered disease patterns. Changes in climate, driven by increased atmospheric CO2, affect the distribution and prevalence of various pathogens and vectors. For example, warmer temperatures can extend the breeding seasons and geographic range of mosquitoes, increasing the risk of diseases such as malaria and dengue fever. Additionally, changes in humidity and temperature can affect the survival rates of airborne viruses, potentially altering infection rates for diseases like influenza. 3. Worsening air quality and respiratory diseases. Increased CO2 levels often coincide with higher levels of pollutants such as ground-level ozone and particulate matter, as these gases can be emitted from the same sources, e.g., vehicle exhausts, industrial emissions. These pollutants can exacerbate respiratory conditions like asthma and chronic obstructive pulmonary disease (COPD). Additionally, as CO2 contributes to climate change, phenomena such as wildfires become more frequent, further deteriorating air quality. Long-term implications and public health strategies. To mitigate these impacts, it is crucial to implement comprehensive public health strategies that include improving ventilation in indoor environments to reduce CO2 accumulation, enhancing public awareness about the importance of air quality and its impact on health, incorporating climate change impacts into health planning and policy making to address both the direct and indirect health effects of increased CO2 levels. Efforts to reduce CO2 emissions are paramount not only for mitigating climate change but also for protecting public health against the diverse and potentially severe health impacts of high CO2 levels. Strategies should be multifaceted, combining environmental, health, and policy perspectives to effectively manage and prevent these health risks. Chapter 3. Mechanisms linking CO2 to viral infections. Direct effects of CO2 on human physiology. 1. Respiratory function and hypercapnia. Physiological response. Elevated CO2 levels can lead to hypercapnia, a condition where CO2 builds up in the bloodstream. Hypercapnia can cause respiratory acidosis, where the blood becomes too acidic. This condition affects the body's ability to deliver oxygen to tissues and can impair immune response, potentially making individuals more susceptible to infections, including viral ones. Studies and findings. Research has shown that high levels of CO2 can suppress the immune response by affecting the activity of immune cells such as macrophages and lymphocytes, which are crucial in fighting viral infections. Schwartz, 2010. 2. Cognitive function and decision-making. Impact on health decisions. Impaired cognitive function due to elevated indoor CO2 concentrations may affect individuals' health-related decision-making capabilities, potentially leading to poor hygiene practices, which can increase the risk of viral transmission. Supporting research, studies, including those by Satish et al. 2012, have demonstrated that CO2 levels as low as 1000 ppm can significantly decrease cognitive function, which could indirectly influence susceptibility to infections by affecting behavior and decision-making. Indirect effects through environmental and ecological changes. 1. Climate change and vector ecology. Vector-borne diseases. Increased CO2 levels contribute to global warming, which in turn affects the habitats and life cycles of disease vectors such as mosquitoes and ticks. Warmer temperatures can expand the geographic range of these vectors, increasing the spread of viruses like dengue, Zika, and chikungunya. Research evidence. Studies by Mordecai et al. 2013 highlight how temperature influences the transmission potential of mosquito-borne diseases by affecting mosquito survival and reproduction rates. 2. Altered human behaviors due to environmental changes. Changes in population density and movement, fluctuations in weather patterns, driven by climate change, can lead to migrations and changes in population density, particularly in urban areas. These changes can increase human contact rates and facilitate the spread of airborne viruses such as influenza or coronavirus. Supporting observations. Research during the COVID-19 pandemic indicated that changes in human movement and density, influenced by weather patterns, had a measurable impact on virus transmission rates. Liu, 2021. Potential research directions. To better understand these mechanisms and their impacts on viral infections, several research directions could be pursued. 1. Longitudinal health studies. Objective: to directly link CO2 exposure levels to changes in immune function and viral infection rates over time. Methodology: collecting and analyzing data from environments with varying CO2 levels, such as different urban and rural settings, and monitoring health outcomes related to respiratory and viral diseases. 2. Integrated climate health modeling. Objective: to predict future trends in viral epidemics based on projected CO2 levels and associated climate changes. Methodology: utilizing advanced climate models combined with epidemiological data to simulate and predict outbreaks of vector-borne and airborne viral diseases. 3. Behavioral studies on CO2 and decision-making. Objective: to explore how suboptimal decision-making under elevated CO2 conditions could contribute to increased viral transmission. Methodology: experimental setups in controlled environments to study decision-making and compliance with public health guidelines under varying CO2 concentrations. In summary, the relationship between increased CO2 concentrations and the spread of viral infections is multifaceted, involving direct physiological impacts and broader ecological and behavioral changes. Understanding these links requires a multidisciplinary approach, incorporating insights from physiology, immunology, environmental science, and public health. Through targeted research and integrated studies, more effective strategies can be developed to mitigate the impact of rising CO2 levels on viral infections. Chapter 4. Review of relevant studies. Epidemiological evidence. Research extensively documents the interplay between climate variables influenced by elevated CO2 levels and the spread of viral diseases. The relationship is particularly evident in the study of respiratory viruses, where environmental conditions directly impact virus survival and transmission dynamics. 1. Influenza and respiratory viruses. Studies and findings. Numerous studies have corroborated that fluctuations in temperature and humidity levels, which can be exacerbated by climate change, are linked to the seasonality of influenza. Lowen et al. 2007 highlighted that low temperatures and low humidity favor the survival and transmission of the influenza virus. Similar patterns are observed with viruses like RSV, where colder, drier conditions increase stability and airborne transmission rates. Additional research, Shaman et al. 2010 demonstrated using viral ecological modeling that absolute humidity directly controls influenza virus transmission and survival, suggesting potential for predicting outbreak dynamics by monitoring weather patterns and implementing timely public health interventions. 2. Vector-borne viral diseases. Impact of climatic factors. The incidence of diseases like dengue, Zika, and chikungunya is also closely linked to climatic conditions that favor vector population growth and virus replication. For instance, Mordecai et al. 2013 found that warmer temperatures can shorten the extrinsic incubation period of the virus in the mosquito, leading to more rapid and extensive outbreaks. Longitudinal observations. Studies over decades in regions experiencing climate shifts show a clear trend of increasing vector ranges and earlier seasonal activity, directly correlated with rising average temperatures and altered precipitation patterns. Experimental and theoretical studies. The mechanistic understanding of how CO2-related climate changes affect viral stability and transmission is also advancing through laboratory experiments and theoretical modeling. 1. Laboratory experiments. Controlled environment studies. Research in controlled settings has shown that increased temperatures and CO2 levels can alter the physicochemical properties of airborne viruses. For example, experiments have demonstrated that enveloped viruses like influenza are more stable in cooler and drier conditions, which are increasingly altered by global warming patterns. Viral mutation rates. Elevated CO2 levels and associated temperature changes could potentially increase viral mutation rates, thereby affecting viral virulence and transmission dynamics. This hypothesis is explored through genetic sequencing and virological assays under varied environmental simulations. 2. Theoretical modeling. Global air currents and virus transmission. Baker et al. 2020 proposed models indicating that shifts in global air currents, influenced by changing temperature gradients in the atmosphere, could modify the paths and spread of airborne viruses. Such changes might result in new patterns of pandemic spread, affecting regions previously considered low risk. Simulation studies. Advanced computational models are being used to simulate how changes in global climate variables affect the survival and transmission of both airborne and vector-borne viruses. These models help predict future outbreaks and inform global public health strategies. 3. Integrative approaches. Coupling epidemiological and environmental data. Recent studies have begun integrating epidemiological data with real-time environmental monitoring to create dynamic models of disease spread that account for changing CO2 levels and associated climatic factors. Policy impact studies. Research is also focusing on how theoretical predictions can be translated into public health policies, assessing the effectiveness of interventions like vaccination campaigns and public awareness tailored to climate-related viral outbreak predictions. In summary, this expanded review underscores the complex and dynamic relationship between CO2-induced climatic changes and viral infections. By integrating epidemiological evidence with experimental and theoretical studies, researchers are increasingly able to predict and mitigate the impacts of these changes on public health. The ongoing challenge is to refine these models and translate this knowledge into effective global health responses. Chapter 5. Public Health Implications. Risk Assessment. Understanding the public health risks associated with rising CO2 levels and subsequent environmental changes involves a multifaceted approach. This approach should integrate diverse disciplines including environmental science, epidemiology, public health policy, and socio-economic studies. 1. Environmental and health monitoring. Enhanced surveillance systems. Developing and deploying advanced surveillance systems to monitor environmental changes and track health outcomes in real time. This includes the use of satellite imaging for environmental monitoring and digital health platforms to track disease prevalence and outbreak patterns. Data integration. Creating integrated databases that combine environmental data, e.g., CO2 levels, temperature, humidity with health data, e.g., incidence and prevalence of diseases to analyze trends and predict future outbreaks. 2. Vulnerability and impact assessments. Identifying at-risk populations, conducting studies to identify demographic groups most vulnerable to the health effects of CO2-related environmental changes, such as children, the elderly, and those with pre-existing health conditions. Socio-economic impact studies, assessing how environmental changes affect different socio-economic groups differently, to tailor public health interventions accordingly. 3. Predictive modeling and risk communication. Advanced predictive models, using sophisticated modeling techniques to predict how changes in CO2 levels could affect environmental conditions and, consequently, public health. Effective risk communication, developing strategies to communicate risks to the public in an understandable and actionable manner, including guidelines for personal protection and community resilience. Preventive strategies. Preventive strategies must address both the mitigation of CO2 emissions and the enhancement of public health systems to better respond to and withstand the health challenges posed by environmental changes. 1. Mitigation of CO2 emissions. Renewable energy initiatives, promoting the adoption of renewable energy sources to reduce reliance on fossil fuels, a major source of CO2 emissions. Legislation and policy changes, implementing policies that enforce stricter emissions standards and support sustainable practices across various sectors, including transportation, industry, and agriculture. 2. Enhancement of public health infrastructure. Strengthening healthcare systems, upgrading healthcare facilities to handle increased disease burdens, especially in areas projected to experience severe environmental changes. Indoor air quality improvement, implementing standards and regulations to ensure adequate ventilation and air filtration in buildings to mitigate the direct effects of elevated indoor CO2 levels. Vector control programs, expanding and innovating vector control strategies to address the shifting patterns of vector-borne diseases driven by climate change. Water quality assurance, ensuring that water treatment facilities are equipped to handle the increased risk of waterborne diseases resulting from environmental changes. 3. Community-based adaptation and resilience building. Education and training programs, educating the public on the health risks associated with environmental changes and training community health workers to effectively respond to these challenges. Building local capacities, supporting local initiatives that aim to improve resilience against environmental changes, such as community health programs and local environmental monitoring efforts. 4. International collaboration and support. Global health initiatives, participating in international efforts to address global health challenges related to environmental changes, sharing resources, knowledge, and technology. Aid for developing countries, providing support to developing nations that might lack the resources to effectively manage the health impacts of environmental changes, including technology transfer and financial assistance. In summary, the public health implications of increased CO2 concentrations and related environmental changes are profound and wide-reaching. Effective risk assessment and preventive strategies require an integrated, global approach that combines technological innovation, public education, policy making, and international cooperation to ensure health resilience in the face of climatic changes. Chapter 6. Future research directions. Knowledge gaps. While significant strides have been made in understanding the broad environmental and health impacts of rising CO2 levels, specific aspects require further investigation to fully comprehend and address their implications. 1. Direct physiological effects of CO2. Mechanisms of CO2 toxicity. Detailed biochemical and physiological research to clarify the mechanisms through which elevated CO2 levels impact human health, focusing on respiratory and cognitive functions. Immune system response. Studies to investigate how CO2 influences the immune system's ability to respond to pathogens, including viruses. This includes both suppressive effects due to potential acidosis and any stimulative effects resulting from adaptive physiological responses. 2. CO2 exposure and viral susceptibility. In vivo and in vitro studies, conducting controlled exposure experiments to assess how varying levels of CO2 affect the susceptibility to and severity of viral infections in human tissues and live subjects. Epidemiological studies. Longitudinal population-based studies to correlate CO2 exposure data with incidence rates of viral infections, controlling for confounding variables such as air quality and population density. 3. Impact of environmental CO2 on disease dynamics. Vector-borne disease focus. Research into how CO2-driven climatic changes alter the behavior and distribution of disease vectors, potentially affecting the spread of diseases like malaria, dengue, and Zika virus. Airborne diseases. Examination of how changes in air currents and urban microclimates, driven by rising CO2 levels, affect the transmission of airborne diseases. Technological and methodological advances. Innovative technologies and methodologies are pivotal in bridging the existing knowledge gaps and enhancing our understanding and response to the health impacts of environmental changes. 1. Remote sensing and environmental monitoring. Satellite imaging. Expanding the use of satellite technology to monitor global environmental changes, including deforestation, urbanization, and large-scale industrial emissions, which contribute to CO2 levels. Climate modeling. Integrating satellite data with advanced climate models to predict environmental changes and assess their potential impact on public health. 2. Big data analytics and artificial intelligence. Data integration. developing platforms that integrate vast amounts of health and environmental data, using machine learning to identify patterns and predict outbreaks. Predictive analytics, employing AI to refine predictive models of disease spread, particularly in scenarios of environmental stress and change. 3. Real-time disease surveillance systems. Internet of Things IoT applications, utilizing IoT devices for real-time health monitoring and environmental sensing, providing data that can trigger immediate public health responses. Mobile health technologies, leveraging mobile technology and apps to collect individual health data and provide real-time advisories to the public, enhancing personal and community health management. 4. Innovative experimental designs. Controlled environment laboratories, building state-of-the-art facilities to simulate various CO2 levels and other environmental conditions, allowing for precise manipulation and measurement of physiological and pathogenic responses. Cross-disciplinary studies, encouraging collaborations across fields such as environmental science, virology, immunology, and public health to foster a holistic approach to research. In summary, the comprehensive understanding and effective mitigation of the health risks posed by increased CO2 concentrations demand an integrated research approach. By addressing the outlined knowledge gaps through innovative technological and methodological advancements, the scientific community can significantly enhance our predictive capabilities and intervention strategies, ultimately safeguarding public health against the backdrop of global environmental change. Chapter 7. Discussion, Advances and Challenges in Addressing CO2-related Health Impacts. The interconnection between rising atmospheric carbon dioxide (CO2) levels and their health impacts, particularly in the context of viral infections, remains a challenging yet critical area of research. Between 2020 and 2024, significant strides have been made in understanding and addressing these complex interactions, thanks to breakthrough scientific findings and innovative technological solutions. Challenging issues. One of the persistent challenges is understanding the direct physiological effects of CO2 on human health, especially its subtle and long-term impacts on the immune system. Recent studies from 2024 have started to map out how elevated CO2 levels compromise immune defenses by altering the signaling pathways that immune cells use to respond to infections. Despite these advancements, the full spectrum of CO2's impact on immune function and its implications for susceptibility to viral and other infections remains not fully delineated. Another challenge lies in accurately predicting and modeling how changes in CO2 concentrations affect the global spread of viruses, particularly under varying climatic conditions. While models have become more sophisticated, integrating more variables and yielding more precise predictions, discrepancies still exist between model predictions and real-world outbreak observations. This highlights a gap in our understanding of the environmental variables and their interactions with human behavior and viral pathogenesis. Breakthrough findings. From 2020 to 2024, several breakthrough findings have reshaped our understanding of CO2's impact on public health. Notably, research published in 2022 demonstrated that increases in CO2 levels are associated with more rapid mutation rates in certain viruses, which could affect their transmissibility and virulence. This finding has important implications for vaccine development and viral outbreak preparedness. Furthermore, studies in 2023 provided new insights into how indoor CO2 accumulation affects cognitive function, showing that CO2 levels previously considered safe could still have minor impairments on higher-order cognitive processes. These insights are prompting a reevaluation of indoor air quality standards worldwide. Technological innovations and AI contributions. Technological advancements and AI have played pivotal roles in tackling the challenges associated with CO2-induced health risks. Startup companies have been at the forefront of developing AI-driven platforms to monitor and analyze environmental data in real time, leading to better predictive models for disease outbreaks. For instance, a startup launched in 2021 has developed a cutting-edge AI system that integrates satellite imaging with ground-based sensors to monitor urban CO2 levels and predict potential health impacts dynamically. This system allows city planners and public health officials to implement more timely interventions to mitigate these effects. Additionally, another breakthrough in AI technology from 2024 involves the use of machine learning algorithms to analyze patterns of viral mutations under different environmental stressors, including elevated CO2 levels. This technology helps researchers and healthcare providers stay ahead of potential changes in virus behavior, enhancing the effectiveness of response strategies. In summary, the period from 2020 to 2024 has been marked by significant scientific and technological progress in understanding and managing the health effects of rising CO2 levels. While challenges remain, particularly in fully understanding the physiological impacts of CO2 and improving the accuracy of predictive models, the integration of AI and innovative technologies continues to provide powerful tools for addressing these complex issues. As research progresses, it is crucial for interdisciplinary collaboration to continue, combining insights from environmental science, public health, virology, and technology to develop effective solutions that can mitigate the health risks associated with increased atmospheric CO2. Conclusion: the comprehensive review of the multifaceted impacts of rising atmospheric carbon dioxide CO2 levels on public health and viral infections underscores the critical nexus between environmental changes and health outcomes. As global CO2 concentrations reach unprecedented levels, primarily driven by fossil fuel combustion, industrial activities, and deforestation, the resultant environmental alterations present significant challenges and opportunities for public health interventions. The direct health impacts of elevated CO2, such as impaired cognitive function, respiratory and cardiovascular stress, and sleep disruption, highlight the immediate physiological responses to indoor CO2 accumulation. These effects not only diminish individual well-being and productivity but also exacerbate the vulnerability of the public during health crises, particularly viral outbreaks. The landmark studies by Allen et al. 2016 and Strm Techson et al. 2016 provide robust evidence linking high indoor CO2 levels to decreased cognitive function and sleep quality, reinforcing the need for improved ventilation and air quality standards in built environments. Moreover, the indirect effects of rising CO2 levels, such as the intensification of heat-related illnesses, altered disease patterns, and worsening air quality, are equally concerning. The aggravation of global warming due to increased CO2 levels extends the breeding seasons and geographic range of disease vectors like mosquitoes, escalating the risks of vector-borne diseases such as malaria and dengue fever. Additionally, changes in humidity and temperature influence the survival and transmission rates of airborne viruses, which could alter the dynamics of respiratory diseases including influenza. The intersection of CO2-induced climatic changes with public health necessitates a strategic approach to mitigate these impacts. This includes enhancing public awareness about the significance of air quality, integrating climate change impacts into health planning, and enforcing policies aimed at reducing CO2 emissions. Effective management of these health risks requires a multifaceted strategy that combines environmental, health, and policy perspectives, ensuring a coordinated and proactive response to the challenges posed by elevated CO2 levels. Furthermore, the exploration of mechanisms linking CO2 to viral infections reveals both the direct physiological effects, such as hypercapnia-induced immune suppression, and indirect consequences through altered vector ecologies and human behaviors. These complex interactions necessitate ongoing research to better understand and model the pathways through which CO2 influences viral infections, enabling more precise and effective public health interventions. In conclusion, the relationship between increased CO2 concentrations and the spread of viral infections represents a critical area of concern that demands a comprehensive, multidisciplinary approach. By continuing to integrate insights from physiology, immunology, environmental science, and public health, and by advancing research and technological applications, more effective strategies can be developed to mitigate the impacts of rising CO2 levels. This integrated approach not only addresses the immediate concerns associated with CO2 but also contributes to the long-term resilience and sustainability of global public health infrastructure in the face of ongoing environmental changes. References: Allen, J.G., et.al. 2016. Associations of Cognitive Function Scores with Carbon Dioxide, Ventilation, and Volatile Organic Compound Exposures in Office Workers. Environmental Health Perspectives, 124-6, 805-812. Enyamba, A., et.al. 2014. Climate Teleconnections and Recent Patterns of Human and Animal Disease Outbreaks. Plus Neglected Tropical Diseases, 6-1. E1465. Baker, R.E., et.al. 2020. Infectious Disease in an Era of Global Change. Nature Reviews Microbiology, 1810, 622-632. Lowen, A.C., et.al. 2007. Influenza virus transmission is dependent on relative humidity and temperature. Plus pathogens, 310, E151. World Meteorological Organization WMO. WMO Greenhouse Gas Bulletin.